the Honorable Board of the Judges, committees, my fellow participants, and the audiences. Good afternoon. In this very special occasion, let me, Shera Cynthia Islami, a dental student from Universitas Indonesia, to present you my research that is supervised by Dr. Febrina and Dr. Ambar, entitled The Role of Oral Health Awareness and Knowledge in Smoking Cessation Motivation, a study among adolescents in Jakarta. In 2018, Indonesia's national health data revealed that the majority of smokers in Indonesia started smoking at the age of 15 to 19 years old. Moreover, the report also recorded the escalation in the number of teenage smokers from 7.2% in 2013 to 9.2% in 2018. Therefore, measures are needed to protect our young generation from smoking and also helping those who have smoked to stop smoking. In order to do so, we need to have strong evidence. The Nazir et al. Study in 2017 suggested that knowing the bad effects of smoking on oral health can prevent teenagers in Saudi Arabia from smoking. Meanwhile, in Al-Abdullah et al. Study in 2019, knowing the things mentioned can increase adolescents' willing to stop smoking. The objective of this study are to discover the level of awareness and knowledge about the effects of smoking on oral health and smoking cessation motivation among adolescents in Jakarta. In this study, we use a knowledge and awareness questionnaire by Al-Abdullah et al. Study and smoking cessation motivation questionnaire by Jolie et al. Those questionnaires have undergone cross-cultural adaptation. The process included a translation into Indonesian language and validity tests. The translation process itself consisted of several steps. The first step is translation into Indonesia by two translators, a sworn translator and one from medical background with TOEFL score above 550 qualification, and then back translated into English with a different sworn translator. The questionnaire then discussed in a panel expert for the final form. Thenceforth, we conducted a reliability and validity test to generate a validated questionnaire. The validated questionnaire was then filled by high school students in Jakarta remotely through Google Form. Those who had electronic and internet limitations were excluded in this study. The data were then processed in SPSS with specific tests depending on the type of the data. As a result, 552 high school students covering all areas in Jakarta participated in the study. Most of the students were aware that smoking jeopardized oral health. Many of these students had little knowledge about specific effects of smoking on oral health. This might happen because the awareness-related question asks more general information compared to the knowledge-related question. The awareness data processed using simple logistic regression revealed that female students who reported never smoked, smoking over a short duration of time, or having the intention to quit smoking, were all more likely to be aware than their control group. In relation to this knowledge, students who never smoked also displayed higher knowledge levels than their peers. These results were in line with previous study, which is raising awareness about the effect of smoking could be an effective way to protect adolescents from smoking. A cognitive dissonance theory from Leon Festinger could also explain why students with longer duration of smoking were less likely to be aware. The theory mentioned that when a change in behavior is difficult to achieve, such as quitting smoking, a change in attitudes occurs instead. Given the difficulty of quitting smoking, the theory would predict that smokers are more likely to adjust their beliefs to justify their behavior than they are to change their smoking behavior. Here, we can see that the level of smoking cessation motivation was low on 22 out of the 51 students reporting the motivation to quit. There were linear correlations between motivation scores and academic score, cessation duration, smoking period, and the intention to quit smoking. Regarding the academic scores, study conducted in Europe by Robert et al. Also mentioned that students who smoke had low academic grades. Speaking of the strong correlation of cessation motivation with cessation duration, trans-theoretical methods stated that the person who has quit smoking for more than 6 months are in the maintenance stage. In this stage, they are now more resistant to the unwanted behavior. Therefore, motivation and confidence is increasing. The possibility of a return to the previous steps of changed behavior gets smaller by the time, but caution is necessary at all times. The intention of smoking correlation to smoking cessation motivation also appeared from another study conducted by Kim et al. They mentioned that the intention of smoking was a determinant of smoking cessation in adolescents. There was no statistically significant differences between awareness and knowledge with smoking cessation motivation. Previous results mentioned that students who never smoked were more likely to be aware and had higher knowledge. Unfortunately, this does not work for students who have smoked, because they were already under the influences of nicotine, which increases their addiction to smoking. This is also explained why students who had longer durations of smoking also had lower smoking cessation motivation. This group needs more than an education regarding the effects of smoking on oral health to be able to help them to stop smoking. In conclusion, awareness and knowledge regarding the effects of smoking on oral health might have a role in preventing smoking, but was not compelling enough in promoting smoking cessation. The challenge may be related to addiction that correlates with smoking duration. This brings us to the end of my presentation. I'd like to thank all the committees and judges for this very special opportunity. Thank you.